Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. A research study published in the Journal of Human Psychopharmacology in July 2022 has shown that providing patients with 100 milligrams per day of vitamin B6 as a supplement can help improve symptoms in those who suffer from anxiety disorders. Now, anxiety disorders are the most common of all mental health problems, which are estimated to affect about 1 in 10 Canadians. Now, people who suffer from anxiety disorders have long periods of intense feelings of fear or distress that are out of proportion with real events. Their brains interpret real or imagined events to be much more risky and dangerous than they really are. As a result, their lives are often full of unease and fear, which interferes with their personal and professional relationships as well as productivity in many cases. Studies show that people often suffer from more than one anxiety disorder, which can involve any combination of panic disorders. So in panic disorders, people have, chest pain, palpitations, shortness of breath, or they can have social phobias where they're afraid of social settings, or a specific phobia like being afraid of flying or afraid of snakes or afraid of heights or open spaces. Or they could have a post-traumatic stress disorder where they're having flashbacks or nightmares, depression, feelings of anger or irrationality. So any combination of these things, often people have more than one type of anxiety disorder if they suffer from an anxiety disorder. Now in the July 2022 study, more than 300 patients were randomly assigned either vitamin B6 supplement at 100 milligrams a day, or a vitamin B12 supplement at 1,000 micrograms a day, or they were given a placebo, and they took one of these supplements each day for a 1-month period with food. So the study showed that the vitamin B12 supplement had a minimal effect on reducing anxiety compared to the placebo, but those taking the vitamin B6 supplement at 100 milligrams a day showed significant improvement in their self-reported anxiety symptoms that was statistically significant and reliable. The researchers suggested that vitamin B6 supplementation helped to increase the synthesis in their brain of GABA. So GABA is a brain chemical or neurotransmitter that has a natural calming effect on emotions and activity in certain regions of the brain. Now, the researchers demonstrated that those who were taking the B6 supplement had elevated levels of GABA, which was confirmed by visual tests carried out at the end of the trial, supporting the hypothesis that vitamin B6 was responsible for the reduction in anxiety. As the researchers indicated, the effect of vitamin B6 supplementation is small compared to that attainable with medication, but it has fewer unpleasant side effects than anti-anxiety drugs. But combining vitamin B6 supplements with anti-anxiety drugs may enable doctors to lower the dosage of medication required or eliminate it altogether, which many patients would welcome. However, the use of vitamin B6 supplements to treat anxiety must be supervised and monitored by a physician who can adjust anti-anxiety medication dosage to suit the needs of the individual patient. Of course, adding cognitive behavioral therapy to the treatment plan is also very prudent in many cases, and some early research suggests that medical marijuana can be helpful in some cases of PTSD. But each case is different, and a well-informed physician should be guiding the assessment and treatment process and the integration of each of these interventions. So if you suffer from an anxiety disorder and your doctor is not aware of the vitamin B6 research, I suggest that you provide them with a link to the study, which I provided in the text below. So thanks for watching, and I'll see you next time.